ICU. We'll jump right in. Next slide, please. Okay, so just a sort of a brief where we are. Cases have been declining for about 2 months. Case reports, although things have flattened out in the last, I'd say, week or two. Still just under 100 people in the hospital. Wastewater signals mixed. Actually, the main source that we look at is showing an increase. I'll show you that in a minute. But we remain much lower in terms of all of our metrics than we were back in December, and we remain at low COVID-19 community levels. And we really do seem to be beyond all the flu and RSV that we were dealing with earlier this winter. And I think it's also just important to note that we are in a much better situation than we were in the prior 2 winters in terms of just the sheer impact of number of cases and severe illness. And I know there's much more home testing now than there was during those earlier winters. But nevertheless, I think the burden in terms of severe disease and even just overall people with COVID in the hospitals is much, much less than what we had seen in prior winters. Next slide, please. So this is the case rate trend. Again, this laboratory reported test doesn't include home tests, but I think the trend is still reliable. We peaked there in early December and then have been on a steady decline until really the last week or two. Next slide. And we look at, because we don't have, laboratory reported tests are only a small fraction of overall COVID infections. We look at other metrics. So test positivity similarly has been on a really steady improvement since December, now down below that 5% threshold. Next slide, please. And our hospitalizations show a very similar pattern. These are daily reported hospitalizations going back to October. We're not quite back to the low levels of the fall. And as I said, there's been actually a bit of an uptick in the last week or so. But certainly not where we were back in December. So these are anyone who is in the hospital with COVID infection, regardless of whether they're hospitalized for COVID-related illness. California, the state, has an approach to use discharge diagnosis records from healthcare facilities to estimate what the burden of COVID disease in hospitalized patients was. And we applied that in Alameda County, looking at hospitalizations in November and December. And about, it ranged from, I think, 47% to 56% in those 2 months were hospitalized with COVID disease. So a little over half, we think, of our COVID hospitalizations are actually people hospitalized with illness due to COVID. Methods are not perfect, but we know that question comes up a lot. Next slide. I mentioned the uptick. This is what I'm talking about. Our wastewater bottomed out in early January during the period of all that wet weather. We might have gotten a bit of an assist there in terms of maybe people staying home a bit more than they would have otherwise. We've had a bit of a rebound in the last couple of weeks. So just going to be watching this carefully. This is also as the XBB 1.5 variant continues to increase here on the West Coast, and maybe that is driving some of this as well. I don't know for certain. Next slide. So I mentioned that XBB 1.5. So you can see this is a map of COVID variants across the U.S. distribution is a little bit different on the East Coast than it is here on the West Coast. XBB 1.5 is this sort of purplish blue color on this map, and you can see it's most of the COVID that has been sequenced, at least there in the East Coast, especially the Northeast. Here on the West Coast, it's lagged a bit, still right around half. But it may be that as it sort of continues to take a hold here, that could contribute to a little bit of an uptick. Based on what's happened on the East Coast, if that's what's going on, I'm not expecting a full-on, second winter wave from this. But, it's COVID. I try not to predict the future. Next slide. In terms of CDC COVID community levels, which are tied to case rates, but also to hospital admissions, you can see most of the country is in low levels, although the Mid-Atlantic Northeast still a little more active. This has actually been an improvement over recent weeks. And out west, it's pretty calm still. Next slide. Okay, so this is really, I think, what we'll spend some time on tonight. These are table is a brief, very high level summary of some of what's coming up with the end of the state emergency declaration, the various federal declarations, and what we are still expecting to happen with the county local health emergency. I will just say that these are, for most people, for most of their lives, these are not going to have a big effect, although the federal changes do have some impacts on healthcare, and those impacts are bigger, especially if you're have been enrolled in Medicaid, Medi-Cal during the COVID pandemic. But they are, they certainly are important, and it is beyond the scope of this call to sort of review all of the changes that are going to come with the rollback of these emergency declarations, particularly the federal declarations, because there's just a lot of different policy changes are tied to those. But I tried to sort of pick out some of the most salient points, and we can provide information in the chat for people who want a deeper dive, some resources. So starting at the federal level, you may have seen in the news, the plan is for the federal public health emergency to end on May 11th. And the federal disaster declaration will also end at the same on the same day. Those are two different declarations. A lot of changes will happen with that, but a few things that I wanted to highlight. So first of all, there is a program to provide COVID care for uninsured people through Medicaid that will end on May 11th. There are also some additional reimbursements that hospitals get that are tied to the this federal emergency declaration that will end. So that's a big issue running in the background. On what used to be tied to the end of the federal emergency, but now is separate, on March 31st, the Medicaid continuous coverage requirement, which what that meant is if you're in Medicaid, Medi-Cal here in California, if you enrolled, let's see, the way it normally works is that you have to have your eligibility status recertified on a regular basis. And all of those recertification procedures were suspended during the pandemic so that people's care wouldn't necessarily be disrupted by that process, especially as they were dealing with all the other disruptions of the pandemic. That's going to end on March 31st. That means that the regular pre-pandemic Medicaid, Medi-Cal in California, Medi-Cal re-enrollment procedures will start. And some people are going to end up losing their Medi-Cal coverage through that process. Now, that won't all happen at once. It's going to happen on a rolling basis, but it is an important thing for people to be aware of. And there are efforts being done. It's statewide by Department of Healthcare Services, and here in Alameda County, it's through the Social Services Agency to try to support people to be ready to re-enroll in their Medi-Cal when that comes up. A few things that aren't going to change on May 11th. So first of all, the medications, vaccines, and tests that are authorized for emergency use by the FDA emergency use authorizations, those are separate. And we don't know when that emergency authority will end. I expect that the FDA is not going to want to stop emergency access to medications that haven't yet received full authorization if they know that they're helpful and effective, which many of these COVID tools are. So we don't know exactly when that emergency use authority is going to go away, but not on May 11th. Also, any medications or vaccines or tests that the federal government has purchased and is making available to the public, that access will continue until those supplies run out. Now, I think that my understanding is that the federal government has not been able to appropriate funds to buy more treatments and vaccines, but there is still plenty of supply. So for the time being, there will continue to be a federal supply of free COVID vaccines and treatments. At the state level, so the governor announced, I think in October, that the state emergency declaration would end on February 28th. The state has actually been rolling back much of the emergency policy waivers and things like that tied to the state emergency declaration for some time. There's only a handful of things left that have to do with who can perform what medical procedures and in what settings and things like that. But there are still some of those. Those are going to get rolled back on February 28th. I think there's a few things that might go to the state legislature for permanent fixes to add some flexibility in terms of the healthcare workforce and who can do COVID testing and things like that. But the other thing that's happening, we've already seen this with the state, is they are rolling back resources, staffing resources, and testing resources, things like that, that have supported the COVID response across the state. So that has really, I think, picked up a bit in the last couple of months, and is going to continue as part of the end, sort of tied to the end of the state emergency declaration. What's not automatically changing, and what we don't yet know the schedule for, is that there are some state health orders in place still, and those are they don't automatically end with the end of the state emergency declaration. I'm still expecting that we might see most of the remaining state health orders rolled back at the end of the month, but I don't know for sure yet. I haven't heard anything. If you've heard something, please share. One of the big ones is the state requires masks in healthcare facilities. We don't know what's going to happen with that policy yet. Another thing that's important at the state level to note, so there's a lot of changes with the rollback of the federal emergency declaration and changes to sort of Medicare and Medicaid policy, but there are some things that are different at the state level, and it's still a little bit early to get a comprehensive summary of all this. But our understanding is that who have insurance or Medi-Cal in California will continue to be able to have testing, vaccines, and treatment for COVID covered without cost sharing, even after all of these things get rolled back. That will continue to be the case. If somebody knows otherwise, again, please share. But that's my understanding. For the time being, you can get access to those things even outside of your normal healthcare network. But later this year, you'll have to. It'll be the free testing treatment, or fully covered, I should say, testing, vaccines, and treatment will only be within in your network. And then the other thing I'd add is, we know that just because people have insurance or some kind of health coverage, that doesn't necessarily mean they don't have barriers to access. And we've seen that a lot just with the pandemic. And so there will be plenty of gaps left to be filled. Right now, we still have tests, treatments, and vaccines. Over time, people who are uninsured are really going to be relying, I think, more on the safety net for those services. But we expect, I think that there is going to be at least some access to those things through various safety net programs indefinitely. And I think we'll learn more in the coming months. So at the local level, we have said for some time now that we will align with the state's timeframe and lift our local health emergency if local conditions permit. Again, we're a slight uptick in the wastewater this week. I'm certainly watching that closely, but otherwise, stepping back and looking at how the whole winter has gone, right now I don't see that we're going to change that timeline. But again, we really want to make sure at the time that we're getting close to that deadline, that things remain relatively calm. That shouldn't have a huge effect on people in terms of policy, but we are going to make some additional changes at the same time. So we have just a small number of COVID health officer requirements still in place in Alameda County that will roll back at that time. I'd say the broadest and most important of these is our isolation requirement. There's a blanket requirement for people to isolate at home. We are going to transition to recommendations only at that point. There won't be a legal requirement for people to stay home. And then we don't have a legal requirement for quarantine for most people at this point. We still do have a legal requirement for quarantine and corrections. We're going to roll back the legal requirement. We're going to continue to recommend quarantine in that setting, but we're moving with the end of the local health emergency away from the use of the local health officer order legal requirements for these things. There's a few other things that are more narrow in scope and are not as having as much of a, are sort of replaced by state policies that we expect still to remain in place. So I'm not going to cover those today for in the interest of time. I think it's really important to acknowledge here, COVID is not going anywhere, right? And so we want to take the opportunity to step away from the sort of legal mechanisms, the emergency legal tools that we had in place. We've been doing this, as you all know, for really since very early in the pandemic, gradually stepping down the sort of legal restrictions. This is really removing the last few of the sort of emergency legal restrictions and shifting to really a guidelines and recommendations based approach for everything, and focusing mainly on aligning with state and CDC guidance on those last few remaining areas where we might be doing things slightly differently. And then last thing I'll comment on is just that the Board of Supervisors passed an eviction moratorium, as I think you probably all know. and they set that eviction moratorium to expire 60 days after the end of the local health emergency. So that is also affected by this. Next slide, please. So I said this, I'll say it again, the emergencies are ending, but COVID is going to remain a part of our lives. There's nothing, there are no big changes in terms of the risk. The greatest risk will continue for older adults and those with serious health conditions. New variants will emerge that may change the calculus. Our understanding of the short and the long-term impacts of infections is really still growing, and treatment and vaccination strategies are going to evolve. There's plenty of uncertainty about COVID still. So I think, as we've been through transitions like this before, but this is a big one, but COVID is here to stay, and we're going to continue to be working on it. And I think, living with it in some form or another, indefinitely. Next slide. And I think this is